Question 1. Animal disease management and control. You are working in a veterinary clinic when you receive a case involving a dog that has shown symptoms of vomiting, diarrhea, and lethargy. After conducting a thorough examination, you suspect a possible infectious disease. Given that some diseases can be transmitted to humans, what are the first steps you should take to ensure the safety of the staff and animals and clients in the clinic? A. Immediately isolate the dog and contact the local public health department for a zoonotic disease investigation. B. Place the dog in a common kennel area and wait for the results of diagnostic tests before taking further action. C. Start the dog on antibiotics immediately and continue with regular clinic operations without taking extra precautions. D. Take the dog outside to an open area and let it rest until it resolves on its own. Answer A. Explanation. In cases of suspected infectious disease, especially those that could be zoonotic, transmissible to humans, the first step should always be to isolate the affected animal to prevent the potential spread of the disease to other animals or humans in the clinic. Zoonotic diseases such as parvovirus or leptospirosis pose a risk to both animal and human health. By contacting the public health department, you ensure proper management and collaboration with public health agencies. Quarantine and additional safety protocols, including wearing personal protective equipment (PPE), should be implemented while awaiting diagnostic confirmation. This approach follows biosecurity and public health principles, minimizing the risk of a widespread outbreak. Question 2. Veterinary medical procedures. What is the primary purpose of using a sterile technique when preparing for minor surgical procedures in veterinary medicine? A. To reduce the risk of infection by ensuring that the surgical site and instruments are free of contaminants. B. To speed up the surgical procedure by reducing the time spent on preparation. C. To ensure that the surgery is performed as quickly as possible with minimal equipment. D. To make the surgery less expensive for the pet owner. Answer A. Explanation. Sterile technique is a critical component of veterinary medical procedures, particularly during surgeries or any intervention that involves opening the body. The primary purpose of sterile technique is to reduce the risk of infection by ensuring that both the surgical site and instruments are free from harmful bacteria, viruses, and other microorganisms that could cause post-operative complications. This technique includes sterile surgical instruments, using sterile drapes, wearing gloves, and maintaining a sterile environment throughout the procedure. The focus is on patient safety and minimizing the risk of post-surgical infections. While efficiency and cost are also factors in surgical care, they do not supersede the importance of infection control. Question 3. Animal behavior and training scenario-based. Sarah, a veterinary technician, is tasked with helping a new client, Mr. Thompson, whose cat Bella has shown signs of aggression such as hissing and swatting at staff members during visits to the clinic. Mr. Thompson has mentioned that Bella was once involved in a traumatic encounter with another animal which might be contributing to her behavior. What steps should Sarah take to ensure the safety of the staff and Bella while addressing her behavior? A. Immediately muzzle Bella and attempt to restrain her as quickly as possible to prevent any further aggression. B. Observe Bella's body language and assess her behavior carefully, using positive reinforcement techniques to build trust before proceeding with any further handling. C. Administer a sedative to Bella to calm her down before handling, ensuring minimal movement and preventing injury. D. Leave Bella in a holding kennel without any interaction. Allow her to calm down on her own and avoid any further handling until her behavior improves. Answer B. Explanation. When dealing with an animal showing signs of aggression, especially one with a history of trauma, it is crucial to take a measured approach. Sarah should first observe Bella's body language, assessing the signs of stress or fear. Positive reinforcement techniques, such as rewarding calm behavior with treats or praise, are essential to help Bella associate the clinic environment with positive experiences. Sudden physical restraint, such as muzzle or administering sedatives, can increase fear and exacerbate aggressive behavior. Instead, Sarah should focus on building trust and gradually desensitizing Bella to the clinic environment. This approach is consistent with best practices in animal behavior and welfare, ensuring that the cat's well-being is prioritized while maintaining safety for the staff. Question 4. Animal health and welfare. In your role as an animal health technician, you are tasked with managing a situation where a dog presents with a chronic illness. The dog's owner is concerned about the potential pain and suffering the animal might experience during its treatment. Given the importance of pain management in animal welfare, what considerations should you keep in mind when assessing and implementing a pain management protocol for the dog? Steps should you take to ensure ethical treatment? A. Begin by assessing the dog's behavior and signs of pain. Then choose the most effective pharmaceutical pain relief based on the severity of the condition, ensuring that the dog receives the necessary treatment regardless of cost. B. Evaluate the dog's condition by reviewing its medical history, conducting pain assessments, and implementing multimodal pain management plan that involves both pharmacologic and non-pharmacologic treatments, considering the physical and emotional aspects of pain. C. Focus solely on pharmaceutical treatments, as non-pharmacologic methods such as behavioral therapy or acupuncture are not widely effective in managing pain in animals. D. Avoid using pain medications altogether in order to allow the dog's immune system to handle the pain naturally and avoid any potential side effects from pharmaceuticals. Answer. B. Explanation. In animal health and welfare, addressing pain is a fundamental aspect of providing ethical and compassionate care. A comprehensive pain management protocol should assess both the physical and emotional aspects of pain, as chronic conditions can lead to both somatic and psychological distress. A multimodal approach combining pharmaceutical treatments, e.g., analgesics, anti-inflammatories, with non-pharmacologic methods, e.g., physical therapy, acupuncture, environmental modifications, is often the most effective in managing pain while minimizing side effects. Evaluating the dog's condition, considering its history, and discussing treatment options with the owner are critical steps. Ensuring ethical treatment involves both managing the animal's pain and addressing the owner's concerns, fostering balanced, holistic approach to care. Question 5. Animal anatomy and physiology. You are working with a team of veterinary professionals to diagnose a horse that is experiencing respiratory distress. Upon examination, you notice abnormal lung sounds and the horse is showing signs of tachypnea and labored breathing. Which of the following is the most likely underlying cause, and what is the appropriate next step in managing the horse's condition? A. The horse may be experiencing bacterial respiratory infection, and the next step is to administer antibiotics while monitoring its vital signs. B. The horse may have condition affecting the pleural space, such as pneumothorax or pleural effusion, requiring immediate diagnostic imaging such as X-rays or ultrasound to assess the condition. C. The horse likely has simple case of allergic rhinitis, which can be managed with antihistamine and should be monitored for a few days. D. The respiratory distress is due to minor obstruction in the upper airways, and the horse should be given sedative to ease its breathing. Answer. B. Explanation. Respiratory distress in horses can stem from a variety of causes, and it is essential to accurately identify the underlying condition to administer appropriate treatment. The signs of tachypnea and labored breathing, coupled with abnormal lung sounds, suggest a more serious issue such as a problem with the pleural space, which includes pneumothorax, air in the pleural space, or pleural effusion, fluid accumulation. Imaging such as X-rays or ultrasound is crucial in these cases to visualize the lungs and pleural space, determine the presence of air or fluid, and guide the treatment plan. While bacterial infections can cause respiratory issues, the severity and signs in this scenario point to a structural or fluid-related issue rather than an infectious one. Proper diagnosis and swift intervention are necessary to avoid complications and ensure the horse's recovery. Question 6. Animal behavior and training. You are managing a behavioral assessment for a dog that has shown aggression towards other animals during walks. The owner, Mrs. Davis, has expressed frustration and is concerned about the dog's ability to interact with other pets in the household. After observing the dog's behavior during the session, you identify several signs of fear-based aggression. What steps should you take to address this behavior, and how should you educate Mrs. Davis on the proper way to manage the dog's interactions? A. Recommend immediate behavioral medication to reduce the aggression and suggest that Mrs. Davis isolate the dog from other pets permanently to avoid further conflict. B. Advise Mrs. Davis to use punitive training methods, such as shock collars or physical correction, to address the aggressive behavior quickly. C. Create gradual desensitization and counter-conditioning plan, helping Mrs. Davis understand that the dog's aggression is fear-based. Building trust and positive associations will take time and consistent effort. D. Suggest that Mrs. Davis rehome the dog to ensure that the household remains safe and free from conflict, as fear-based aggression cannot be managed. Answer. C. Explanation. Fear-based aggression is often rooted in anxiety and a lack of socialization or positive experiences with other animals. In such cases, the most effective approach is not through punitive methods but through positive reinforcement and behavioral modification techniques. A desensitization and counter-conditioning plan involves gradually exposing the dog to the feared stimuli, other animals, in a controlled manner while rewarding calm behavior. Over time, this helps the dog build new positive associations with previously feared situations. Educating the owner, Mrs. Davis, about the fear-based nature of the behavior and the need for patience and consistency is crucial. Punitive methods or isolation can exacerbate the problem and harm the relationship between the dog and owner. Reharming should be a last resort after all behavior management options have been exhausted. Question 7. Infection control and biosecurity. During an outbreak of a contagious disease in your animal facility, you are tasked with implementing strict infection control measures to prevent the spread of the infection. Which of the following practices is most essential in managing the outbreak, and how should it be executed to ensure maximum biosecurity? A. Isolate infected animals in separate enclosures, maintain strict hygiene protocols, and minimize contact between animals and staff to reduce the risk of transmission. B. Focus only on cleaning surfaces and equipment, assuming that limiting animal-to-animal contact will naturally control the spread of the disease. C. Place all animals in a single isolation area to monitor the disease spread without using personal protective equipment, PPE, to avoid unnecessary costs. D. Allow normal animal movement within the facility while closely monitoring symptoms to avoid stressing the animals further with isolation protocols. Answer A. Explanation. Infectious disease outbreaks require immediate and comprehensive biosecurity measures to prevent the spread of pathogens. Isolating infected animals in separate enclosures reduces the risk of direct transmission between animals, while strict hygiene protocols, e.g., hand washing, disinfecting surfaces and equipment, help control environmental contamination. PPE, including gloves, gowns, and masks, should be worn by staff to prevent cross-contamination between animals and ensure their own protection. Regular monitoring and implementing quarantine protocols for both new and sick animals are also critical. Assuming that limiting animal-to-animal contact alone will manage an outbreak is insufficient. Without implementing a full biosecurity plan that includes hygiene, isolation, and PPE, the risk of further spread remains high. Question 8. Animal facility management. As an animal care facility manager, you are reviewing the layout of your facility to ensure it meets the legal and ethical standards for animal housing and welfare. What key factors should you consider when designing the facility to promote animal welfare while maintaining regulatory compliance? A. Design spacious enclosures with adequate enrichment, ensure proper sanitation and waste disposal systems, and provide sufficient ventilation to minimize stress and promote the well-being of animals. B. Focus solely on maximizing the space for human staff and minimizing the space for animals, as they will adapt to smaller confined areas. C. Prioritize cost-saving measures, such as minimizing the number of staff and using low-quality material to reduce overhead expenses. D. Design the facility based on aesthetic principles rather than the functional needs of animals, assuming that a visually appealing space will meet all their needs. Answer A. Explanation. The design and maintenance of an animal facility must prioritize the physical and psychological well-being of the animals in care. This includes providing spacious enclosures that allow for natural movement and enrichment activities, ensuring that animals have access to stimulation that promotes mental health. Proper sanitation and waste disposal systems are essential to minimize the spread of disease and maintain a healthy environment. Adequate ventilation is also crucial in reducing stress and respiratory issues. Regulatory compliance requires adherence to animal welfare standards, which emphasize proper housing, nutrition, and care for the animals. Cutting corners on quality or focusing on aesthetics over functionality can compromise the health and welfare of the animals and violate legal regulations. Question 9. Animal nutrition and dietetics. You are working with a veterinarian to manage the dietary needs of a senior cat that has been diagnosed with kidney disease. The veterinarian recommends a special diet that helps manage the cat's condition. What are the most important considerations in formulating diet for cat with kidney disease, and how should you advise the owner on feeding practices? A. The diet should focus on high protein content to help the cat maintain muscle mass, and feeding should be frequent to ensure that the cat consumes enough calories. B. The diet should be low in phosphorus and protein, as these nutrients can exacerbate kidney damage, and the feeding frequency should be tailored to the cat's appetite and weight management. C. The diet should be high in carbohydrates to support energy needs, and the cat should be allowed to will to prevent overeating. D. The diet should include high fat content to ensure the cat gains weight quickly, and feeding should be done only once a day to avoid overfeeding. Answer B. Explanation. In managing kidney disease in cats, dietary modifications play a crucial role in slowing disease progression and improving quality of life. A diet low in phosphorus and protein is recommended, as excessive amounts of these nutrients can further damage the kidneys. Reducing protein intake helps decrease the kidney's workload, while limiting phosphorus prevents its accumulation in the blood. Carefully controlled feeding schedule necessary to manage the cat's appetite and weight, as these animals may experience changes in appetite due to their condition. Regular monitoring of weight, hydration levels, and blood work is important in ensuring that the dietary plan remains effective. High carbohydrate or high fat diets are not suitable for cats with kidney disease, as they can worsen other health conditions. Question 10. Animal surgery and postoperative care. A dog has undergone a routine spaying procedure, and you are responsible for monitoring its recovery in the post-anesthesia recovery room. Upon examination, you notice that the dog is lethargic, has pale gums, and is showing signs of mild abdominal distension. What are the potential causes of these symptoms, and what immediate actions should you take to ensure the dog's safety? A. These symptoms may indicate an adverse reaction to anesthesia, and the dog should be monitored closely for any signs of respiratory distress while administering intravenous fluids to stabilize its condition. B. The dog's lethargy and pale gums suggest dehydration, and you should offer it water immediately to encourage drinking and prevent further complications. C. The dog may have experienced complications such as internal bleeding or gastricate, and you should perform thorough examination to identify the cause and consult with the veterinarian for further diagnostic testing. D. These symptoms are normal after anesthesia and should resolve on their own within few hours, so no immediate intervention is necessary unless the dog shows signs of severe distress. Answer C. Explanation. Lethargy, pale gums, and abdominal distension in a post-operative dog can be indicative of several potential complications, such as internal bleeding or gastrointestinal issues, e.g. bloating or gastric dilation. Internal bleeding, especially in spaying procedures, can occur if blood vessels were not adequately ligated or if there is trauma to surrounding tissue. Abdominal distension could also signal a post-op complication such as peritonitis or gastric issues like bloating. Immediate intervention involves performing a thorough examination and potentially conducting diagnostic tests such as ultrasound or X-rays to rule out severe complications. Fluid administration may be necessary, but the first priority is to identify the cause of the symptoms. Monitoring for respiratory distress and other signs of shock is also essential. Question 11. Animal behavior and communication. You are working with a team of animal behaviorists to rehabilitate a dog that has developed separation anxiety. The dog exhibits excessive barking, chewing, and urination when left alone. Which of the following approaches would be most effective in treating the dog's separation anxiety, and how should you implement the treatment plan? Using combination of positive reinforcement, gradual desensitization, and counter-conditioning, you can slowly get the dog accustomed to being alone for increasingly longer periods while rewarding calm behavior. B. Administering anti-anxiety medications and using physical punishment when the dog exhibits signs of anxiety will deter further problematic behaviors and reduce separation anxiety quicker. C. Isolating the dog from human interaction for a period of time will help it become more independent and reduce its dependence on the owner, thus alleviating the anxiety. D. Ignoring the dog's signs of distress and allowing it to experience the anxiety without intervention will help it eventually adjust to being alone, as dogs naturally adapt to difficult situations over time. Answer. An explanation. Separation anxiety in dogs is a complex behavioral issue that requires a multifaceted approach. The most effective treatment typically involves a combination of positive reinforcement, gradual desensitization, and counter-conditioning. Gradual desensitization involves getting the dog accustomed to being alone in small increments of time, rewarding calm behavior, and slowly increasing the duration of separations. Counter-conditioning helps the dog form positive associations with being alone, reducing anxiety over time. Anti-anxiety medications may be prescribed by a veterinarian in severe cases, but should be paired with behavioral training. Punishment or isolation can worsen the dog's anxiety and make the problem more difficult to manage. Question 12. Emergency medical care for animals. You are the lead technician in an emergency animal hospital when a cat is brought in after being hit by a car. The cat is in shock with rapid heart rate, weak pulse, and cold extremities. What are the most crucial steps you should take to stabilize the cat before the veterinarian arrives? A. Administer high doses of pain medications immediately to relieve the cat's pain, ensuring it is as comfortable as possible. B. Focus on providing warmth to the cat, administering intravenous fluids to stabilize circulation and monitoring its vital signs closely. C. Perform quick assessment and then wait for the veterinarian to take charge without intervening in the meantime. D. Focus on treating external injuries such as lacerations without addressing the cat's shock or vital signs. Answer. B. Explanation. In cases of shock following trauma, such as being hit by a car, the primary goal is to stabilize the animal's vital signs before further treatment can be administered. Providing warmth through blankets or warming pads is crucial to prevent hypothermia, which can exacerbate shock. Administering intravenous fluids is essential to stabilize circulation and restore blood pressure, especially if the cat is showing signs. Hypovolemic shock. Monitoring the cat's heart rate, respiration, and temperature while preparing for further veterinary intervention is essential. While pain management is important, immediate administration of high doses of pain medications is not priority before addressing shock and stabilization. Waiting without action or focusing solely on external injuries can delay life-saving interventions. Question 13. Animal nutrition and digestive health. You are tasked with developing a nutritional plan for a dog diagnosed with inflammatory bowel disease (IBD). The dog is experiencing chronic vomiting, diarrhea, and weight loss. What dietary modifications should be made to address the dog's condition, and how can the dog's gastrointestinal health be best supported? A. Provide high-fiber diet to promote regular bowel movements and prevent constipation, while introducing variety of proteins and carbohydrates to diversify the diet. B. Offer low-residue, highly digestible diet with single novel protein source and limited ingredients to reduce irritation in the gastrointestinal tract and ease inflammation. C. Focus on high-fat content to help the dog maintain weight. And administer probiotic. Restore the balance of intestinal bacteria. D. Provide regular commercial dog food diet, assuming that the inflammation will resolve on its own without major dietary changes. Answer. B. Explanation. Inflammatory bowel disease in dogs involves chronic inflammation of the gastrointestinal tract, which can lead to malabsorption of nutrients and gastrointestinal discomfort. A low-residue, highly digestible diet is recommended to minimize irritation to the intestines and promote better nutrient absorption. A limited ingredient diet that features a single novel protein such as duck or venison can reduce the food allergies or sensitivities aggravating the condition. These dietary changes help manage inflammation and allow the gastrointestinal system to heal. High-fat diets or high-fiber diets are generally not suitable for dogs with IBD, as they may worsen symptoms like diarrhea or vomiting. Probiotics may be beneficial in some cases, but they are not a replacement for dietary adjustments. Question 14. Animal breeding and reproduction. You are assisting with the artificial insemination AI process for a breed of dogs that has a history of reproductive challenges. The female dog is in estrus and semen from a male dog has been collected and prepared for insemination. What factors should be considered to increase the likelihood of a successful AI procedure? A. The timing of insemination should coincide with the peak of ovulation, and the semen should be evaluated for motility and concentration to ensure high-quality samples. B. The AI procedure should be done as early as possible in the estrus cycle to avoid complications, regardless of the timing of ovulation. C. Insemination should be performed after the female has been in estrus for several weeks to ensure that the eggs are mature and the reproductive tract is optimal for fertilization. D. Semen should be collected from the male dog immediately before insemination without any prior evaluation, as the freshness of the semen is the only important factor in success. Answer. A. Explanation. The timing of insemination plays a critical role in the success of artificial insemination in dogs. To increase the likelihood of a successful pregnancy, insemination should occur near the peak of ovulation when the female dog's eggs are most viable. The quality of the semen also plays an important role in the success of AI at evaluating the semen for motility, the ability of sperm to move, and concentration. The number of viable sperm ensures that only high-quality semen is used for insemination. Premature or delayed insemination outside the optimal ovulation window can result in reduced conception rates. The health and condition of the female dog's reproductive tract should also be assessed to ensure the best possible outcome. Question 15. Veterinary pharmacology and drug administration you are caring for. The dog diagnosed with Lyme disease and the veterinarian prescribes doxycycline as part of the treatment plan. The dog is also on a regimen of multiple medications for pre-existing conditions, including corticosteroids and a diuretic. What considerations should be taken into account before administering doxycycline, and how should you proceed? Avoid potential drug interactions. A doxycycline should be given on an empty stomach to maximize absorption, and you should monitor the dog for any signs of gastrointestinal upset or diarrhea, which may be exacerbated by the corticosteroids. B. You should administer doxycycline with food to reduce the likelihood of gastrointestinal irritation and adjust the dosage of corticosteroids to prevent immune system suppression. C. Doxycycline should be withheld if taking corticosteroids, as this combination can lead to an increased risk of severe adverse effects, including gastrointestinal ulceration. D. The diuretic therapy should be adjusted to account for the diuretic's interaction with doxycycline, as this can lead to electrolyte imbalances and affect drug absorption. Answer A. Explanation. Doxycycline is a tetracycline antibiotic used to treat Lyme disease, and it should be administered with care when the dog is also on other medications. It is generally recommended to administer doxycycline on an empty stomach for optimal absorption. However, if the dog experiences gastrointestinal upset, giving the medication with food may reduce discomfort. Corticosteroids can suppress the immune system and increase risk of secondary infections, but there is no direct contraindication between doxycycline and corticosteroids in the treatment of Lyme disease. Monitoring for gastrointestinal side effects like diarrhea or upset stomach is important, especially since doxycycline itself can cause gastrointestinal irritation. Diuretics do not significantly interfere with doxycycline absorption, but careful monitoring of electrolyte levels is important. Multiple medications are involved. Question 16. Canine infectious diseases and prevention. A client brings their 8-week-old puppy to the clinic for its first set of vaccinations. The puppy's vaccination schedule includes vaccines for distemper, parvovirus, adenovirus, and rabies. The owner has expressed concern about the potential side effects of these vaccines. What information should you provide to the owner regarding vaccine safety and the importance of maintaining the vaccination schedule? A. Vaccines are generally safe and are essential for preventing potentially life-threatening diseases. Side effects, if they occur, are usually mild and temporary, including swelling at the injection site or mild fever. B. Vaccines should only be administered if the puppy shows no signs of illness, as vaccination during illness can lead to severe side effects, including seizures. C. Vaccines should be delayed until the puppy is older, as vaccination at this age interfere with natural immunity from the mother's milk. D. Vaccination is unnecessary for puppies that are kept indoors, as they are not at risk of contracting these diseases. Answer and explanation. Vaccination is crucial in preventing serious and potentially fatal diseases such as distemper, parvovirus, and adenovirus. Side effects from vaccines are generally mild and temporary, such as mild swelling at the injection site, a low-grade fever, or lethargy. These reactions are typically short-lived and do not outweigh the risk of the diseases that vaccines protect against. Vaccination is still important even if the puppy is indoors, as infectious diseases can still be transmitted through contact with other animals or contaminated surfaces. It is essential to follow the recommended vaccination schedule to ensure that the puppy's immune system is adequately protected. Delaying vaccines or postponing them due to concerns about side effects can leave the puppy vulnerable to severe diseases. Question 17. Animal pain management. A cat has undergone a major abdominal surgery to remove a tumor, and the veterinarian has prescribed pain relief medications, including opioids, for postoperative pain management. The cat is alert but is showing signs of discomfort, such as vocalization and restlessness. What steps should you take to ensure that the cat's pain is effectively managed, and what considerations should be made regarding opioid use? A. Administer the prescribed opioid as directed and monitor the cat closely for signs of opioid overdose, such as respiratory depression or sedation. B. Ensure that the cat remains undisturbed for several hours to allow the body to naturally adjust to the pain without administering any additional pain relief. C. Increase the dose of the opioid medication to maximize pain relief, regardless of the prescribed dosage guidelines, to ensure the cat comfortable. D. Substitute the opioid with non-steroidal anti-inflammatory drugs, NSAIDs, as they are a safer alternative for postoperative pain and have fewer side effects. Answer A. Explanation. Opioids, such as morphine or fentanyl, are commonly prescribed for postoperative pain management in animals undergoing major surgeries. It is essential to follow the prescribed dosage and monitor the cat for signs of potential side effects, such as respiratory depression, sedation, or reduced appetite, which may indicate overdose. The cat's pain level should be assessed frequently, and adjustments to the pain management plan be made in collaboration with the veterinarian. Increasing the opioid dosage without veterinary consultation can lead to dangerous side effects, such as overdose. Substituting opioids with NSAIDs may not be appropriate post-surgery, as NSAIDs are not as effective for managing severe acute pain, and they come with risks in certain cases, e.g. gastrointestinal irritation, kidney function concerns. Monitoring and communication with veterinary team are essential for effective pain management. Question 18. Veterinary diagnostic imaging. You are working in a veterinary clinic when a dog is presented with a suspected fracture following a fall. The veterinarian has ordered radiographs, X-rays of the affected limb. What are the key steps in preparing the dog for radiographic imaging, and how should you ensure the procedure is performed safely and effectively? A. The dog should be sedated before the procedure to ensure it remains still during imaging, and all jewelry and clothing should be removed from the area of the body being imaged. B. Radiographic images should only be taken after the dog is fully restrained in a specialized radiographic restraint device to avoid any movement during imaging. C. Proper positioning and restraint are essential, but sedation should be avoided unless absolutely necessary. It can affect the results of the imaging. D. Sedation or general anesthesia is required for all radiographs to ensure that the dog remains completely still during the procedure. Answer C. Explanation. Radiographic imaging in veterinary medicine requires careful preparation and positioning of the animal to ensure that accurate and diagnostic images are captured. Proper restraint is crucial to prevent movement during the imaging process, but sedation is not always required unless the animal is in pain or cannot remain still. The goal is to minimize stress while ensuring the animal is comfortable. Restraint devices or the assistant. A technician may be used to stabilize the dog's position without sedation. In many cases, the dog should also have all non-essential items such as collars and jewelry removed to avoid interference with the imaging process, while sedation or anesthesia may be necessary in some cases, e.g. in aggressive or highly stressed animals. It is generally avoided unless essential to ensure safety and comfort. Question 19. Feline infectious diseases. A cat has been diagnosed with feline leukemia virus FeLV and is showing signs of lethargy, weight loss, and poor coat condition. The owner is concerned about the cat's prognosis and potential transmission of the virus to other animals in the household. What information should you provide to the owner regarding FeLV transmission and care for the infected cat? A. FeLV is highly contagious, and the infected cat should be isolated from other cats in the household to prevent transmission. Additionally, supportive care should be provided to manage symptoms and improve the cat's quality of life. B. Feline leukemia is only contagious during the acute phase of infection, so the cat can be safely integrated into the household once the symptoms resolve. C. FeLV is not transmissible through saliva, so the infected can safely interact with other cats as long as they do not share food or water bowls. D. FeLV-infected cats should be euthanized immediately to prevent suffering, as there is no effective treatment for the virus. Answer A. Explanation. Feline leukemia virus FeLV is a retrovirus that is transmitted primarily through saliva, nasal secretions, and blood, often through grooming, biting, or sharing food and water dishes. FeLV-infected cats are at risk for developing various secondary infections, anemia, and lymphoma. While there is no cure for FeLV, infected cats can live for varying amounts of time depending on their health status and response to supportive care. Crucial to isolate infected cats from other cats to prevent transmission of the virus. Providing supportive care, including appropriate nutrition and treatment for any secondary infections, can help improve the cat's quality of life. Euthanasia is not necessarily indicated unless the cat is suffering severely, and each case should be evaluated individually. Question 20. Animal nutrition and dietary considerations. A 5-year-old Labrador Retriever is diagnosed with osteoarthritis and is being transitioned to a joint supportive diet recommended by the veterinarian. The new diet includes increased omega-3 fatty acids, glucosamine, and chondroitin. The owner is concerned about how this will affect the dog's overall health, especially regarding its weight and energy levels. What should you advise owner about managing the dog's weight while ensuring it receives the benefits of the new diet? A. The dog should be allowed to consume as much food as it wants to ensure it gets all the necessary nutrients, as osteoarthritis can cause weight loss due to reduced activity. B. You should recommend increasing the dog's physical activity, even with osteoarthritis, to maintain healthy weight while feeding the new joint supportive diet. C. The dog's caloric intake should be monitored closely to avoid weight gain, as the new diet may be higher in fat. Excess weight can worsen osteoarthritis symptoms. D. Weight management is not concerned with joint supportive diets, as these diets are specifically formulated to promote weight gain for better mobility and joint health. Answer C. Explanation. When transitioning a dog to a joint supportive diet, it's important to monitor its weight carefully. Excess weight can exacerbate the symptoms of osteoarthritis by putting additional strain on the joints, while joint supportive diets often contain beneficial ingredients such as omega-3 fatty acids, glucosamine and chondroitin. They may also be higher in fat content, which can contribute to weight gain if not monitored. Balanced approach, including controlled portion sizes and regular exercise within the dog's limits, is key to managing the dog's weight and ensuring the diet's effectiveness in supporting joint health. Overfeeding or allowing unrestricted access to food could lead to obesity and worsen the condition. Question 21. Canine respiratory diseases. A 6-year-old golden retriever presents with a history of coughing, nasal discharge, and labored breathing. The veterinarian suspects canine influenza (HN). What steps should be taken to diagnose this condition, and what management strategies should be recommended to the owner? A. Canine influenza can be diagnosed through a physical examination alone, as it has distinct clinical signs. Treatment usually consists of antibiotics and steroids to reduce inflammation and combat infection. B. Diagnosis of canine influenza should be confirmed with laboratory tests, such as PCR or serology, to detect the virus. Symptomatic treatment, including supportive care and antiviral medications, is essential. Canine influenza is diagnosed through imaging techniques like radiographs, and treatment should include corticosteroids to suppress the immune response. D. A simple blood test is sufficient to diagnose canine influenza, and the dog should be immediately isolated from other animals to prevent transmission. Answer B. Explanation. Canine influenza (HN) is a viral respiratory infection that can cause coughing, nasal discharge, and difficulty breathing. To confirm the diagnosis, laboratory tests, including polymerase chain reaction (PCR) or serology, are required to detect the virus. While antibiotics are not effective against viral infections, secondary bacterial infections may develop, and antibiotics may be prescribed in cases. The primary treatment for canine influenza is supportive care, including fluids, rest, and in some cases, antiviral medications if indicated. Isolation of the infected dog from other animals is important to prevent transmission, as canine influenza is highly contagious. Corticosteroids are generally avoided for viral infections, as they can suppress the immune response and delay recovery. Question 22. Pet behavior and training. A 2-year-old border collie has developed a habit of barking excessively when left alone at home. The owner is concerned about the behavior, as it is disturbing the neighbors. What would be the most effective approach to address this issue, considering it may be related to separation anxiety? A. The dog should be reprimanded for barking when the owner returns home, as this will help teach the dog that barking is not acceptable. B. Gradual desensitization to being left alone, combined with positive reinforcement for calm behavior, is the most effective method for addressing separation anxiety. C. Ignoring the dog when it barks will eventually stop the behavior, as the dog will learn that barking does not attract attention. D. The dog be confined to a crate whenever left alone to prevent excessive barking, and the owner should avoid any contact with the dog for several hours. Answer B. Explanation. Separation anxiety is a common cause of excessive barking when a dog is left alone. The most effective way to address this issue is through gradual desensitization, which involves slowly increasing the time the dog is left alone while rewarding calm behavior. This helps the dog learn to tolerate being alone without anxiety. Positive reinforcement for quiet behavior is crucial in teaching the dog what is expected. Punishing the dog or reprimanding it for barking after the behavior has occurred can increase stress and worsen anxiety. Confining the dog to a crate may be helpful for safety, but it is not a solution to the underlying anxiety. Instead, addressing the emotional cause of the behavior is key to long-term success. Question 23. Feline health and treatment. A 3-year-old Siamese cat is diagnosed with hypothyroidism, a condition that often presents with symptoms such as weight loss, increased appetite, and restlessness. The veterinarian has recommended radioactive iodine therapy I-131 as the treatment of choice. What should the owner know about this treatment and what precautions should be taken post-treatment? Radioactive iodine therapy is highly effective and safe, requiring no special precautions after the treatment. The cat can immediately return to normal activities, including interaction with other pets and people. B. After radioactive iodine therapy, the cat should be isolated for a period of time to minimize radiation exposure to humans and other animals, and frequent follow-up testing will be required to monitor thyroid function. Radioactive iodine therapy is not recommended for hypothyroid cats as it can worsen the condition and cause permanent damage to the thyroid gland. D. The treatment involves surgery to remove the thyroid gland, and the radioactive iodine is used to shrink the tumor before surgery. Answer B. Explanation. Radioactive iodine therapy I-131 is the gold standard treatment for hypothyroidism in cats, as it targets and destroys overactive thyroid tissue without the need for invasive surgery. However, because the therapy involves radiation, precautions are necessary after the treatment to minimize exposure to humans and other animals. The cat will need to be isolated for a period of time, usually of days to a week, depending on the specific guidelines provided by the veterinarian. The cat should also undergo follow-up testing to ensure that thyroid hormone levels return to normal and to monitor for any potential complications. This treatment is generally safe and highly effective in curing hypothyroidism in cats without the need for removal of the thyroid gland. Question 24. Exotic animal care and veterinary medicine. A 2-year-old pet rabbit is presented with a lack of appetite, lethargy, and gastrointestinal stasis, stasis. The owner is concerned and is unsure of the cause. What is the most likely cause of the symptoms and what steps should be taken to diagnose and treat the rabbit? A stasis in rabbits is commonly caused by a lack of fiber in their diet, leading to inadequate gastrointestinal motility. The treatment involves changing the rabbit's diet to include more fresh vegetables and introducing antibiotics. Stasis is typically caused by bacterial infections and should be treated with antibiotics. Fecal culture may be necessary to identify the specific bacteria. C. The most common cause of yeast. A diet low in fiber, which results in reduced gut motility. The treatment involves increasing fiber intake through hay and supportive care such as fluids and pain management. D. Stasis is rarely seen in rabbits, and the symptoms are likely due to an unrelated illness. The rabbit should be monitored closely and no immediate treatment is necessary. Answer C. Explanation. Gastrointestinal stasis, stasis, is a common and potentially life-threatening condition in rabbits. It typically results from a lack of adequate fiber in the rabbit's diet, which is necessary for proper gut motility. Treatment involves addressing the underlying cause by increasing the rabbit's fiber intake, particularly through high-quality hay, and providing supportive care, such as fluids and pain management, to help restore gastrointestinal function. Antibiotics are not typically used unless there is evidence of secondary bacterial infection. Early diagnosis and treatment are essential to prevent further complications such as dehydration or gut perforation, which can result from untreated stasis. Question 25. Canine skin conditions and treatment. A 4-year-old beagle presents with recurrent skin infections, itching, and hair loss, particularly around the ears and paws. The veterinarian suspects a food allergy as the underlying cause. What steps should be taken to diagnose and treat the condition, and what dietary changes might be necessary? Skin infections in dogs are usually bacterial in nature, and the treatment should focus on antibiotics and topical corticosteroids. No dietary changes are necessary. B. A food allergy can be diagnosed with an elimination diet trial where common allergens such as chicken or beef are removed for several weeks. Treatment should include antibiotics for secondary infections and a hypoallergenic diet. C. The dog's symptoms likely due to viral infection, and the best course of treatment is antiviral medications. No dietary changes are needed, and the dog should be given anti-inflammatory drugs. D. Skin infections are most often caused by fungal organisms, so antifungal medications should be prescribed. High-protein diet should be introduced to support skin health. Answer B. Explanation. Recurrent skin infections, itching, and hair loss can be indicative of a food allergy, which is a common cause of dermatologic issues in dogs. The most effective way to diagnose a food allergy is through an elimination diet trial. This involves removing potential allergens, such as common proteins like chicken or beef, from the dog's diet for several weeks and observing for improvement in symptoms. If symptoms improve, allergy is likely. Antibiotics may be prescribed for secondary bacterial infections, and hypoallergenic or novel protein diet is often recommended to prevent future allergic reactions. Topical corticosteroids or antihistamines may also help manage itching, but addressing the root cause through dietary management is key. Question 26. Feline renal disease and monitoring. A 10-year-old domestic short-eye cat has been diagnosed with chronic kidney disease (CKD) based on blood work that shows elevated creatinine and urea nitrogen levels. The veterinarian recommends dietary modification and fluid therapy as part of the management plan. What should the owner be instructed to do to help manage the cat's condition? A. The cat should be fed a high-protein diet to promote muscle mass, and fluids should be administered at home to prevent dehydration. B. A low-protein, phosphorus-restricted diet is recommended to reduce the kidney's workload. Additionally, subcutaneous fluids may be needed to manage dehydration and maintain kidney function. C. A high-carbohydrate diet should be introduced to help with weight gain, and oral medications should be used to lower potassium levels. D. The cat should be placed on a grain-free diet to improve kidney function, and regular blood tests are unnecessary unless symptoms worsen. Answer. B. Explanation. Chronic kidney disease (CKD) is a common condition in older cats, and its management focuses on reducing the kidney's workload. Low-protein, phosphorus-restricted diet is recommended to slow the progression of the disease, as excessive protein and phosphorus can exacerbate kidney damage. Additionally, the kidneys may have difficulty conserving water, so fluid therapy, subcutaneous fluids, is often used to manage dehydration and support kidney function. Regular veterinary checkups and blood tests are crucial to monitor the cat's kidney function and adjust the treatment plan as needed. High carbohydrate or grain-free diets are not typically part of the management for CKD unless specifically indicated for other conditions. Question 27. Avian medicine and nutrition. A pet parrot has been diagnosed with malnutrition after presenting with feather plucking and a dull, unhealthy appearance. The owner reports feeding the bird a diet primarily consisting of sunflower seeds. What dietary recommendations should be made to improve the bird's health? A. The bird should continue with sunflower seeds as they provide sufficient fat and nutrients. However, a multivitamin supplement should be added to ensure all nutritional needs are met. B. The diet should be changed to a varied and balanced mix of fruits, vegetables, and fortified pellets to ensure the bird receives essential nutrients, and sunflower seeds should be limited due to their high fat content. C. The bird should be switched to a seed-only diet, but sunflower seeds should be replaced with pumpkin seeds as they are lower in fat and more nutritious. D. The bird should be given a high-protein diet to promote feather growth and energy, and seeds should be eliminated entirely from its diet. Answer. B. Explanation. Sunflower seeds, while enjoyable for many pet birds, are high in fat and lack essential vitamins and minerals, making them unsuitable as the sole component of a parrot's diet. Malnutrition in parrots is often due to lack of balanced diet. To address this, the bird's diet should be shifted to a mix of high-quality pellets that are fortified with essential nutrients, along with fresh fruits and vegetables to provide variety and vitamins and minerals. Limiting sunflower seeds is necessary to avoid excessive fat intake, which can contribute to obesity and other health problems. Varied diet is key to improving the bird's overall health, including its feather condition. Question 28. Canine heart disease and early detection. A 7-year-old Cavalier King Charles Spaniel has been diagnosed with mitral valve disease, ME, a common condition in small breed dogs. The veterinarian recommends early treatment to slow disease progression. What signs should the owner monitor for that could indicate worsening heart disease, and what treatments might be needed? A. The owner should monitor for coughing, lethargy, and difficulty breathing, and medications such as diuretics and ACE inhibitors may be prescribed to manage symptoms and slow disease progression. B. The dog may start exhibiting signs of excessive thirst and urination, and a special low-sodium diet should be provided to manage fluid balance. C. The dog is likely to develop skin infections due to compromised immune function, and antibiotics are the primary treatment. D. Sudden weight gain and changes in appetite are indicators of MVD progression, and the dog should be switched to a high-protein diet to help build muscle mass. Answer. A. Explanation. Mitral valve disease (MVD) is a common cardiac condition in small breed dogs, particularly in Cavalier King Charles Spaniels. Early signs of worsening heart disease include coughing due to fluid accumulation in the lungs, lethargy, and difficulty breathing. Treatment typically involves medications to manage heart function and reduce fluid buildup, such as diuretics, ACE inhibitors, and sometimes pimobendan to improve heart contractility. Monitoring the dog's symptoms and scheduling regular veterinary checkups are essential to managing the condition. Special diet may be prescribed, but it usually focuses on managing fluid balance and sodium intake rather than promoting muscle growth. Question 29. Rabbit gastrointestinal health. The 3-year-old pet rabbit has been refusing food, has a bloated abdomen, and has been experiencing diarrhea. The owner is concerned that the rabbit might have a gastrointestinal problem. What steps should be taken to diagnose and treat the rabbit, and what preventive measures should be considered? Gastrointestinal issues in rabbits are typically caused by a bacterial infection, so the rabbit should be given antibiotics and a high-fiber diet to support gut health. B. The rabbit is likely experiencing gastrointestinal stasis, a condition that requires prompt treatment with fluids, pain management, and a high-fiber diet to restore gut motility and prevent complications. C. The rabbit may have a parasitic infection, and treatment include deworming medications. A low-fiber diet should be provided to reduce gut irritation. D. The symptoms indicate a food allergy, and the rabbit should be switched to a grain-free diet immediately to alleviate gastrointestinal upset. Answer B. Explanation. Gastrointestinal stasis is a common and serious condition in rabbits characterized by reduced or absent gut motility leading to bloating, anorexia, and diarrhea. It is often caused by an inadequate diet, particularly one low in fiber, or stress. Immediate treatment includes providing fluids to prevent dehydration, pain management to reduce discomfort, and increasing fiber intake through hay to promote gut motility. Severe cases, additional interventions such as motility drugs may be needed. Preventive measures include ensuring the rabbit has constant access to fresh hay, proper hydration, and a stress-free environment. Antibiotics or deworming are not typically indicated unless there is a confirmed secondary infection or parasitic cause. Question 30. Feline diabetes and insulin management. A 9-year-old domestic short-eye cat is diagnosed with diabetes mellitus. The veterinarian has recommended starting insulin therapy, along with dietary changes to help manage the condition. What factors should the owner consider when administering insulin, and what dietary recommendations should be made? A. Insulin should be administered once daily at the same time each day, and the cat's diet should consist mainly of high carbohydrate foods to help manage blood sugar levels. B. The cat should receive insulin injections twice daily, ideally with meals, and its diet should consist of high protein, low carbohydrate foods to support stable blood glucose levels. C. The cat should only be given insulin when blood sugar levels are high, and its diet be high in fiber to slow glucose absorption. D. Insulin therapy is unnecessary if the cat's blood sugar levels are not elevated, and the diet should focus on high-fat foods to promote weight gain. Answer B. Explanation. Diabetes mellitus in cats is commonly managed with insulin therapy to regulate blood glucose levels. Insulin injections are typically given twice daily, with the ideal timing being around meal times to help match the insulin peak with the cat's food intake. High protein, low carbohydrate diet is often recommended to help stabilize blood glucose levels, as carbohydrates can cause spikes in blood sugar. Monitoring blood glucose levels at home, regular vet visits, and ensuring consistent insulin administration are key to managing the condition. High-fiber or high-fat diets are not typically used in managing feline diabetes unless specifically indicated by other health concerns.